So, Mr. Schneider, before we begin today, I just want to look over your health history to make sure there's no changes. So, I see here that you have been diagnosed with hypertension and high cholesterol. Is that correct still?
Yeah, that's correct. I've had hypertension and high cholesterol for I think about 3 years now. My doctor put me on I think a couple medications for those.
Okay, so you're currently taking medications as of right now?
Yeah, I'm currently taking I think it's lisinopril. I think that's for my blood pressure. And then statin for my cholesterol.
Okay, perfect. That's very good to know. With these medications, have you experienced any certain side effects from them?
No side effects. I do kind of get headaches every now and then.
Okay. Do you have headaches right now? Are you feeling okay right now? Dizzy or?
No headaches right now.
Okay.
I'm feeling good.
Okay. So, have you had any changes to your health? To your overall health? Maybe with vision or speech?
No changes.
Okay, perfect. Great. Okay, one last question. Are you under any increase of stress, anxiety, depression?
You know, now that you mention it, I've been really stressed with work lately. It's just such a busy schedule, and it's been hard to get in a dental office to get a cleaning, especially with my really busy work schedule.
Yeah, thanks for sharing that information with me. Stress can definitely play a role. So if you feel uncomfortable at any time in your appointment, just let me know and we can do something about it. So now I'm gonna go ahead and take your vitals. All right, Mr. Schneider. So it looks like your blood pressure is 135 over 85, which falls into the range of stage 1 of hypertension. And then your pulse was 76 and your respiration was 16.
Yeah, that's what my normal blood pressure usually falls under. I know with without the medication, I'm really high, maybe stage 2 hypertension.
Okay, so since it's higher than normal, I will have to recheck it in 5 minutes. So just to be sure, and I have to go let my instructor know that you have high blood pressure.
Oh, I where?
Are you feeling all right, Mr. Schneider? Can you smile for me, please? Can you lift your left arm? Oh, I think Mr. Schneider's having a stroke. I have code blue in room 21. I need help. Can you lift your right arm for me?
I'll get the dentist. You need me to call 911?
Yes, please. Okay, Mr. Schneider, I'm going to go ahead and take your blood pressure one more time and attach your pulse ox to your finger. Mr. Schneider, your blood pressure is really high.
We called 911. Help is on the way. Do you need oxygen?
Yes, his oxygen is 85. I need you to administer 4 liters of oxygen.
Okay.
EMS is here.
The proper response from the hygienist was crucial. Recognizing the signs of a stroke, facial dropping, slurred speech, and arm weakness allowed her to respond quickly to this kind of emergency. Immediate action was taken to notify the nearest student about the medical emergency. Activating code blue, and patient was placed in a semi-upright position to aid the blood flow and comfort. The patient oxygen level were low, so oxygen was administered. Vitals were constantly taken until EMS arrived and took over the medical emergency. It's imperative to stay with the patient in case the patient goes unconscious. If the patient goes unconscious, you will put them in a supine position and provide basic life support. To prevent situations like this, patients with hypertension should have their blood pressure closely monitored before dental procedures. Treatment modifications could also be helpful, such as minimizing stress during the appointments and perhaps shorter appointments visits. If the patient has a busy schedule that causes stress and early appointments might be best instead of a midday appointment. In this case, a referral to the patient's primary care physicians for follow-up on stress management and blood pressure control is highly recommended.
A stroke is an abnormal condition of the brain characterized by occlusion or hemorrhage of blood vessels resulting in a lack of oxygen. A stroke occurs when an artery or blood vessel carrying vital oxygen and nutrients to the brain bursts or becomes blocked by a clot, causing the part of the brain affected to die. In this situation, the patient experienced a stroke due to his pre-existing conditions, including hypertension and high cholesterol, which are common contributors to such medical emergencies. Lisinopril and statin, which the patient was taking, were medications that would have typically helped to manage these conditions. However, factors like the recent stress at the dental chair may have aggravated his health.
How are you doing today, Mr. Snyder?
I'm doing really
So if you start feeling overwhelmed, just let me know and we can do something about it. In your appointment today, if you start feeling